Cramps in late pregnancy. Know what can cause cramps late in your pregnancy. Braxton Hicks. Preterm labor. Separation of placenta. Round ligament pain. Cramps in late pregnancy. Every expecting woman will experience cramps in late pregnancy due to one reason or the other. In most cases, these cramps are perfectly normal and are a common experience. However, there are certain times when these cramps can mean danger. It isn't new for a pregnant woman to experience cramps during any phase of her entire pregnancy. Cramping in pregnancy is normal and every expecting mother experiences it at one point or the other. However, there are a few situations that might arise out of medical complications, and in these situations, cramping might mean danger to the mother or the child. The first 2 months and the last 2 months are very crucial, and a pregnant woman has to take more care than compared to the other months. It is very important to be educated about the various reasons that might cause mild cramps in late pregnancy, or pains that might resemble cramps but mean more grave for a situation. Sometimes, the causes of these cramps are not related to the pregnancy at all but solely to the abdomen. Information in the paragraphs below will help clear the confusion surrounding cramping while pregnant and its causes. Know what can cause cramps late in your pregnancy. Abdominal cramps in late pregnancy are also included in the various cramps in pregnancy, and seldom do they have anything to do with the pregnancy. One of the most common reasons for these pains are urinary tract infections, UTI, and they occur mostly in late pregnancies when the urge to urinate increases. UTI are mostly responsible for pelvic cramps late in a pregnancy as well. Appendicitis is another such reason for abdominal pain that might be confused with cramping. This is one of the most common extrauterine surgical complication according to the American Pregnancy Association that can develop during pregnancy. Food poisoning, improper bowel movements, stomach virus, kidney stones and pancreatitis are other causes that lead to these pains. Braxton Hicks. Though Braxton Hicks are experienced first in early pregnancy, they are felt throughout the pregnancy and only increase in intensity as the pregnancy continues. Braxton Hicks are cramps that are experienced by the pregnant woman due to the tightening of her uterus. These cramps are named after the English doctor who first introduced the concept in 1872. His name was John Braxton. Some women may experience these directly towards the end of the pregnancy while some might experience them right from the start. These cramps are not like labor as they are not continuous and last for only a few seconds. At times, they even stop if you change your current position. Preterm labor. Very few women deliver on the due date their doctor gives them. The rest either deliver earlier or later. However, at times, the labor starts much before it is expected to. If you're experiencing cramps towards the end of your pregnancy, you might want to time them. If these cramps are felt after exact intervals of time, you might have entered labor much before your actual due date. This is called preterm or premature birth. Cramps in these circumstances might actually feel like sharp pains after some time, and it is important that you call your doctor immediately if in doubt. Separation of placenta. In some cases, the placenta detaches itself from the uterus later in the pregnancy, leading to a condition called placental abruption. The abruption can be partially, only to some extent, or complete, when it happens entirely. It is not very common for this situation to occur, but the pains felt when this happens resemble cramps. Due to this, it might take some time for you to understand what is exactly happening. The moment you feel the cramping turning into sharp pains, you need to call your doctor. If this is accompanied by discharge or spotting, you should immediately check in the nearest hospital. The pain won't subside and you will also notice reduction in your baby's movements. Round ligament pain. Most pregnant women are educated about round ligament pain by their respective doctors, but yet at times this pain is confused with normal cramps in pregnancy. Inside the belly, there are ligaments that support the uterus as it grows faster during the later stages of pregnancy. It is natural for these ligaments to stretch as the uterus increases in size. When the stretching takes place, the pregnant woman experiences cramps in her lower abdomen. This pain might start in the second trimester for most women, but sometimes, it can start in the third trimester too. These were some of the common and not so common causes of cramps in late pregnancy. Cramping during pregnancy is a completely normal phenomenon. Only when these cramps, especially in the third trimester, are accompanied with brown or reddish discharge, should there be some reason for worry or when the cramps turn to pains. At all times, do not diagnose yourself and consult the doctor immediately. Medication and self-treating should be strictly avoided during every phase of pregnancy.